My name is Mike Schnaubelt. I'm a board-certified orthopedic surgeon at BayCare Clinic. My training started at Marquette University. I did my undergraduate work in biomechanical engineering. I then went to the University of Wisconsin for medical school. And then after that, I did my orthopedic residency for 5 years in Grand Rapids, Michigan. My specialty emphasis is predominantly hip and knee replacements and also arthroscopic surgery of the shoulder, knee, and ankle. I chose orthopedic surgery because of my undergraduate background in biomechanical engineering. It's kind of a natural fit. In my undergraduate work, we did work on artificial limbs, creating prosthetics, and also on joint replacement implants. My philosophy for providing healthcare to patients is to start with conservative treatment. I'll try to exhaust physical therapy and other options, whether it be injections or medications. And then if someone isn't responding to conservative treatment, then we'll discuss surgical options. I also like to get the patient involved in their care from early on. I think they're more apt to follow the treatment if we get the patient and sometimes even their family members involved in their care. I see patients of all ages. That's why I like orthopedics, anywhere from a newborn with a club foot to a patient who's elderly and needs a joint replacement. During a patient's first visit with me, they can expect that their problem will be able to be told in its entirety. I'm not the type of doctor that'll cut a patient off and just start up with my agenda. I like to hear the full story from them. I think you can learn a lot just from letting the patient talk, and patients want to be heard. So I try to hear them out, and I try to give them a diagnosis before they leave the door and start their treatment path and make sure they're well aware of what to expect right away for treatment and maybe plan B or plan C should the first treatment option not work. I think my patients appreciate the most about me is that I'm a good listener and I will hear them out. I spend a lot more time with my patients than some doctors do. I've even had patients tell me on feedback reports that they felt like they were my only patient for the day and that I had their undivided attention and I just spent a lot of time with them. I think that means a lot to patients. The most challenging part of my practice is trying to meet the demands of patients in today's society. Everybody wants to be treated right away. They want to get through their rehab and just want to get back to work and back to activities they want to do right away. They don't want me to tell them you're going to have some downtime here. So for me, the challenge is trying to meet those needs, but in a safe way and getting them back as quickly as we can. With some of the newer innovations in terms of less invasive surgery and newer technologies in terms of implants and faster rehab protocols, we're able to meet some of those needs. For me, the biggest reward in my practice is watching someone recover from a surgery when they've walked in and are either terribly hobbled from arthritis or a painful condition or maybe even in a wheelchair. For me, I had a patient recently that was only 49 years old, had seen 3 or 4 orthopedic surgeons before me for a hip replacement, and no one would touch her because of her age and other medical conditions. And I talked to that patient, we worked her through the surgery, and she's done phenomenal, and she basically told me that I gave her her life back. To me, that's the most rewarding part of my job.